Thank you. Thank you so much for the opportunity. I'd like to just try and share my screen. So if you would just permit me to do that. Is my screen visible now?
Yep.
Thank you so much to be given this opportunity to present to this committee. And our submission detailed every piece of the legislation as it relates to early childhood development. And I thought to just use this opportunity to give a succinct overview and an additional background. So we all know that investment in the future workforce starts by investing in the very young from birth. And if you want to scale access to quality ECD programs, we can unlock pathways out of poverty. We can build employment and productivity, and we can level up developmental outcomes for children. South Africa's National Development Plan, Vision 2030, states that the country intends to make ECD a top priority amongst measures to improve quality education and the long-term prospects of future generations. So really very passionate about the plight of young children and their early development in the early years. So over 1 million children aged 3 to 5 years in South Africa have no access to early learning programs. To achieve universal access to ECD for all boys and girls in South Africa by 2030, an investment of 34.3 billion rand is needed into early childhood development. And we need at least 350,000 qualified ECD practitioners and assistants if we want to be able to provide universal access. And I think the most thrilling thing is that for every rand that we invest in early childhood development, there's a tenfold return, not only for the individual, but also for society at large. So Scotland has proudly been serving children for the past 85 years. And really for us, it's all around how do we make the world a better place for children. And so we set up early learning playgroups since 2012. And we provide activities for children so that they are able to socialize, and also we act as a referral point for other services. We have two types of playgroups. We have a playgroup aimed at young babies from the age of birth to 2, which the babies are accompanied by their mothers, and we do a program specifically related to that age group. We also have a program for 2 to 4-year-old groups, and we have a nurse that does basic health screening and then acts as a referral for psychosocial and other health interventions. We conduct parenting workshops as part of our early learning playgroup work, and we're very passionate about building capacity in caregivers and in parents. So when we take a look at the work that we also do in terms of toy libraries, and that's really the lens that I would like to amplify this morning, is to really put the plight of toy libraries on the table and within sight of yourself, Mr. Chairperson, and the honourable members attending this meeting. So toy libraries provide developmentally appropriate educational play materials to early childhood development service providers, parents, children, and this is defined in the integrated ECD policy. So toy libraries have various ways in which they deliver services. They either provide a come and play service, which is 2 hours, a mobile play session where a vehicle goes out, sets up a space in the community and allows for children and their parents to access the services. Also a lend and play service where toys are borrowed for a period of 2 weeks and then exchanged, the same as you would do with books. We also, as toy librarians, do make and play sessions and create toys from waste and show parents how everyday objects can become playful items and can help children to learn. Again, the toy librarian do capacity building and train the community and members of the toy library on best practice and other related ECD information. And then we also participate in events, and World Play Day, which is coming up on the 28th of May, is a really big one for us, and I want to encourage the chairperson and others listening to this, please join us in celebrating the importance of play as we do this very important work of making sure that children access play-based learning opportunities. Scotland is also a very proud member of the Toy Library Association of South Africa, of which I'm also the chairperson and have the privilege of working with 12 other organizations in the country, representing 41 toy libraries, and also serving and touching the lives of 17,139 beneficiaries. Our reach in the country seems to be more focused on the eastern side, if you look at the map, and CLAS is working tirelessly to raise the profile and the importance of toy libraries within the ECD landscape. So toy libraries has a close relationship with government. So when you look at toy libraries, and should be located as part of municipal book libraries, since that is the mandate from imposed on the Department of Arts and Culture. In terms of the Department of Social Development, it's really important that they play the role of registering these toy libraries and also providing funding. In terms of Department of Basic Education, the toy libraries work very well within school book libraries and can serve children with the necessary toys and play materials. And then the Department of Health, which has fantastic coverage and access to young children through their program of vaccinations and immunizations of children, is a really fantastic place to also locate toy libraries. And I thought to use the opportunity to share a video with you very briefly as a means of showing the work in action. So I do trust that I'll be able to launch this. Otherwise, I'll just proceed and I could play the video at the end. So just allow me a minute.
We're here today because we come to launch the mobile clinic together with the mobile toy library. Scotland is collaborating with Mondi and the Department of Health in a project where we're taking health and early learning to the children in their communities. So rather than waiting for them to come and ask for services, we're taking the services to the community.
When Scotland were introduced to us as the Department of Health, and they showed us the Mkondo Toy Library, I just couldn't wait to see this happening in the province.
For any concrete development, cognitive development, and social skills development, you need to catch them when they're still young. For them to have that social skills, ability to navigate life, and be future citizens.
Mondi facilitated that we all work together because Mondi is supporting the Department of Health by sponsoring them with the mobile health vehicles. The mobile clinics to the community, they've got the schedule, they've got the routes, and the children come to the mobile clinic for immunization and other health-related problems. The nurse will actually provide primary health care to the community and the children, where the toy library will then set up a place where the parents can register their children and set up the area which is really conducive for the children to learn while they play. You see access to learning, you see the future of the country.
So that's our much of
We're
our
here today because we
apologies of our work in action. We thought that really just makes it come alive and show what the potential is of collaborating and coordinating the work that happens in early childhood. Scotland's also to help solve the problems with making sure that we have a workforce that is qualified and can actually take on and deliver these programs, have launched our Scotland's Ignite e-learning training platform. And we're very proud that we have 66 learners on this platform who are working towards a qualification in both toy librarianship, but also to be fully qualified ECD practitioners. So when we look at the impact that we've made as an organization, we're very proud of the 11,859 children that we serve through our early learning playgroup and toy library model at a very affordable cost of around 200 Rand per beneficiary per month, and of 2,500 adults that participate in our parenting and capacity building training, and then also our latest innovation, the 66 learners that we've enrolled onto our platform. So we know that the work that we do benefits both children and the families that we serve. So first and foremost, we provide the access that's needed Through toy libraries and playgroups, we are able to offer the service free because it's sponsored through government, individuals, and corporate South Africa. We know that children have fun when they come into our sessions, and we see the laughter and the joy of being able to participate in these programs. We see the learning through play, and I'll share with you some empirical evidence that we have around the success of our program. And we also see that we can improve children's school readiness scores through these non-center-based programs, as it's defined within the ECD policy. Our children receive a snack and a cooked lunch. They have access to the screening by a nurse who can then also do health and psychosocial referrals. We provide toys and play materials from the toy library, which parents can use at home to play with their children. And we feel, if we look at some of the amendments we requested in our formal application or submission, we feel very strongly that we should start thinking through programs for parents in their homes, and then also that we give access to our parents and support them in their journey of parenting, and also allow and build their capacity. Parenting is quite a daunting task, and so as a collective, I think that ECD programs and the amendment bill needs to address this, and then also to capacitate other organizations so to replicate this model. I think we've got a lot of success stories in the country, but we're not seeing these programs being rolled out at scale. So Cochrane's participated in the Early Learning Outcomes measure study in 2017. And this is a rigorous instrument that really tests the programmatic impact of a program, and also it's been standardized within South Africa. It also indicates a program's effectiveness in terms of preparing children for grade R. And I guess what excited us the most was the fact that it looked at the domains of cognition and executive functioning, emergent literacy, emergent numeracy and mathematics, fine motor skills, and also gross motor skills. So the baselines were conducted in 2017 and the summatives in October of 2017. And these results then showed that because of the work that we are doing, that we were able to shift children's school readiness scores from being yellow, so en route, to being ready. And this was really such a fantastic opportunity and confirmation of the work that we do. So the green on this particular graph indicates the expected standard. So this is where we would like for children to be by the time that they start school. And the yellow indicates the grouping of children that are at risk. And then the red are the children falling behind. And so the value of ELOM's external evaluation, that we were able to identify gaps in our program. And also, in fact, in the assessments that were done early on in that particular year, we realized that we did not have a very strong fine motor skills program. The team came together, we worked on reviewing our learning plans, and we refined that specific aspect of our fine motor skills. And as a result of changing those elements in our program in the subsequent months, the children's fine motor scores were able to move from red into green. So in fact, it was sitting somewhere here and then moved into green. So we also know that the toy libraries play a major role to ensure quality provisioning, which ultimately increases children's school readiness scores. So we'd like to make a few recommendations, also with the support of the Toy Library Association of South Africa, and wish to recommend the following changes within the Children's Amendment Bill. Our first recommendation is to provide toy libraries access to funding against set norms and standards to ensure quality provisioning by toy libraries. Toy libraries also need to be able to access programmatic funding so that we can ensure that we programmatic funding. We really feel that there should be a set of norms and standards. There are a set of norms and standards that were developed specifically for toy libraries in collaboration with officials from the Department of Social Development and the Toy Library Association South Africa. And we feel that these should be incorporated into the one-step registration process. And by considering this recommendation when amending the bill, will promote the best practice principles for toy libraries. This will also help us expand career opportunities within the sector, and that we make sure that we are able to and also we would like, as a toy library grouping, to be consulted when the norms and standards and the registration process are being refined, so that we could add our expertise also to the thinking as the bill becomes changed or amended. We also would like to make a second recommendation, and that is to prioritize programs that are easy to implement and impact large numbers of children, such as non-center-based programs. Prioritizing non-center-based programs such as toy libraries in the same manner as ECD centers. So because we know that there's an array of programs, and that they should each be afforded equal status and opportunity. Toy libraries impact the lives of thousands of children, and the programs are quick and fairly easy to implement, and mostly make use of safe, secure and accessible play spaces that are located within the community. Government can definitely help the cause by providing underutilized municipal infrastructure to operate toy libraries and even early learning playgroups from. Our third recommendation to you, Mr. Chairperson and honourable members of Parliament, is to ensure that the provincial departments of arts and culture set up toy libraries in municipal book libraries. This will ensure that we increase access to play-based opportunities. Sadly, the municipal libraries have failed to fulfill their mandate, and you can also help us unlock discretionary funding for ECD on municipal levels. Scotland has the skills and knowledge to upscale toy libraries in collaboration with government and the Toy Library Association of South Africa. Our fourth recommendation centers around, as government and civil society, we have a collective responsibility to build the capacity of qualified practitioners that are able to deliver quality play-based early learning programs, both center-based and non-center-based. We have to address the skill shortage of qualified ECD practitioners, which means they can work in ECD centers or in toy libraries or in early learning playgroups or in a home visiting program. If we do not invest in the ECD workforce, poorer children, according to research, are more likely to receive poor quality programs. And there's an urgent need to build the capacity to reach our goal of universal access for 1 million children by 2030. We also need to create secure jobs for qualified ECD practitioners by providing them with a living wage and recognizing them as a workforce. Our fifth recommendation to this esteemed committee is to accelerate toy library services and training for parents to facilitate play in their home environment. This has really rung so true when the COVID pandemic, closed all the ECD programs, and everybody had to find ways to reach parents and to try and keep their programs from taking place. So parent training is required to promote and amplify the power of play. Thank you. I'm about to close. And so children spend most of their time at home, and they have very little access to these playful opportunities that bring about learning. In closing, amendments to the bill that's specific to the toy libraries is a simpler one-step registration process, making sure that the norms and standards consider toy libraries, provincially, working collaboratively with each other, building the capacity of the providers in the community, and also providing training to parents. And then we also would like to put an appeal forward in terms of the process that may be followed by this portfolio committee. We really would want to urge the committee to commit to strict and urgent timelines for the finalization of possibly the Second Amendment bill, if that's the decision that gets taken, which also meets our call for key reforms, to clearly establish who will be responsible for leading the finalization of the Second Amendment bill, and also to secure joint sittings of the Portfolio Committee on Social Development and the Portfolio Committee on Basic Education should be prioritized if we wish to move this amendment of the bills in the right direction. And then in closing, Chairperson, I thank you and the honourable members of Parliament for this opportunity. Let's keep our eye on why we are all here today. It's all about the children, our future workforce. Making ECD work for our children requires political will and a concerted effort to collectively join forces with stakeholders to amend the Children's Bill and to ensure our legislation is enabling and truly serves the children of our country. We are in this together, and because we serve the children of South Africa and we are here to help, let's create universal access for all children of South Africa by 2030, and so that we are able to serve a range of ECD programs which are supported by toy libraries and that are able to operate within a legislative framework that works for all and substantially changes the trajectory of ECD in South Africa. Thank you so much for the opportunity to present to this committee.
Thank you. Thank you, Doc.
Pleasure.
Thank you very much for such a stimulating, very positive presentation, rather more about how to take things to a higher level. Thank you very much. And all those innovative interventions and so on.